Health agencies and world leaders are meeting once again to try to map a course out of the COVID-19 crisis. The virtual gathering, co-chaired by the US, the WHO and Germany, will urge wealthy countries to ramp up their coronavirus relief efforts.
We'll accelerate the delivery of more vaccines to countries that need it, pledging to deliver 200 million more doses within the next 100 days. On our way to delivering more than 1,200 million doses for the rest of the world.
Biden wants other countries to donate $2 billion for coronavirus treatments, like the Paxlovid antiviral pill, and $1 billion for oxygen supplies to lower-income nations. Paxlovid, developed by Pfizer, is the latest COVID-19 treatment, and early results suggest it reduces the chance of hospitalization by up to 90%. Though still in the trial phase, it's widely available in the US. Since vaccines for the virus emerged, unequal access to treatment has exposed the stark inequalities between rich and poor nations. WHO data shows more than 11 billion doses have been administered globally, and 65.5% of the world population has received at least one dose of a COVID-19 vaccine. Africa has the lowest vaccination rate of any continent, with just 20.3% of the population receiving at least one dose, compared to 79% in the US and Canada. Underdeveloped countries rely on an international vaccine sharing arrangement called COVAX, which has largely failed due to export bans and vaccine hoarding by wealthy nations.
Much of this inequity has been driven by the fact that globally vaccine production is concentrated in a few mostly high-income countries.
Biden will again urge his counterparts to make good on their pledges, but the high cost of Paxlovid and pharmaceutical companies' reluctance to waive patents means it's likely to take at least a year before it's available to those who need it the most, with experts warning of a spike in cases between June and September in Africa and the possible emergence of new variants. Swift action by world leaders is essential. Rumeysa Codar, TRT World.